Hello, good evening. This is Dr.MJ Wesley. Yet I'm here again with another video in the bite-sized medicine series from Pacesdiaries. This is a video on movement disorder every clinician should know. We are going to see around 10 plus movement disorders, which we all should know. At the end, I'll just give the definition of different movement disorders. It's a quick video to check our knowledge. It's going to tremendously help you in your clinical practice. And it doesn't matter whatever medicine residency you are doing, you're an attending, you're a consultant, you're a professor, it's going to just help you to brush up the knowledge. And especially for residents and medical students, this is going to be an immense source of information, and very especially candidates preparing for their MD General Medicine, mrcp UK, mrcp Ireland, DNB medicine, FCPS medicine. It's going to be of a great help. All right, let's go 3, 2, 1. Now see this particular movement. How's it looking like? Stretching his hand, isn't it looking like some wing is beating, wings of bird beating to flap up? See here carefully. When the arms are approximated. Getting it? Yes, this is Wilson's disease. This is your classical wing beating tremor. All right, let's go to the next movement. Many will be wondering what kind of movement disorder is this? This is one of the patients I encountered. This is Parkinson's disease patient. She had tremor in both her leg, and you could have noticed an asymmetrical tremor in her right hand. This is the tremor of Parkinsonism. For further things about Parkinson's, I had a patient examination video on Parkinson's, and I have a video of how to differentiate between essential tremor and Parkinson's tremor. You can watch that video. All right, this is a leg tremor in Parkinson's. Now see here, this is the asymmetrical tremor. I hope all of you got the diagnosis. This is Parkinson's disease. Now look at this particular tremor movement. See here, if you just go about, yes, how it looking like? It's looking like a flap. Yes, it is. It's a flap. This is a patient with decompensated liver disease. It's a flapping tremor. Okay, now see this tremor. This is a tremor typically caused due to antipsychotic drugs. Okay, during the withdrawal phase, sometimes people get into that. You will obviously be given a history before this. Can you guess what tremor is this? This is like some kind of pumping movement. You know, in one hand, high amplitude, high flying tremor. Any idea what is this? This is, again, see here, a high amplitude, high flying tremor. This is Holmes midbrain tremor or a rubral tremor. It's a Holmes midbrain tremor or a rubral tremor. Can you guess what tremor is this? Or what kind of abnormal movement is this? Guess what? You would have got it. Yes, this is a cerebellar tremor. This is a cerebellar tremor. Can you guess this tremor? Bilateral. You would have got it. Very fine tremor. See here. Bilateral. Very fine tremor. Yes, this is a tremor of thyrotoxicosis. Can you guess what movement disorder is this? See the way his legs move, see the way his hands moves, kind of fidgety. This is a patient with Huntington's chorea. This is choreiform movement. Now, can you guess what movement is this? Can you carefully see? It is looking like as if he is holding a pen between his thumb and the index finger, and he is trying to write something with the pen. This is an athetosis. All right, this is an athetosis. Can you guess what tremor is this? All right, this is a hemiballismus. This is another movement disorder. No, this is a hemiballismus. Can you guess this movement disorder, whatever it is? Look at the leg. Look at the right leg. It's a flicker. It's a flicker in the right leg, if you carefully see. Yeah, there's a flicker of movement on the right leg. What is that? This is your myoclonus. This patient was a suspected case of Creutzfeldt-Jacobson disease. Can you guess what is this? I think most people would have been knowing that. This is the jack-in-the-box phenomenon for rheumatic chorea. This movement, see his neck. This is a case of torticollis. This is a case of torticollis. All right. Can you guess this movement again? This is already we have seen. Just one more patient with a similar movement. See his movement, see his hands, see his stance, see his gait. It's called a coriform gait. This is a patient of Huntington's chorea. Can you guess this movement? Hip thrusting movement. This is a classical movement you will see in pseudo seizure. All right, we will talk about seizures in a separate video. Finally, we have seen a lot of movements. A quick notice, athetosis, it's a slow, continuously involuntary writhing movement, commonly affecting arms and hands. What is a chorea? This is a rapid, chaotic movement that seems to flow from one body part to the other. Then comes dystonia, we have seen. Torticollis, it's a type of dystonia. It's a sustained, repetitious muscular contractions, often produce an abnormal posture, like we have seen in the video. Then tremor, it's a rhythmic back and forth oscillatory movement, oscillatory involuntary movement. Then tics, it's a sudden, rapid, recurrent, non-rhythmic movements, or sometimes vocal tics, vocalizations can be there. Then there can be stereotypical movement. Then myoclonus, we have seen the sudden, brief, involuntary muscle twitch. Hemiballismus, that is a sudden, intermittent flinging or ballistic high amplitude movements. Tardive dyskinesia, uncontrollable repetitive movements of the tongue, lips, face, trunk, and extremities. Then comes akathisia, inner feeling of restlessness, an inability to sit. Primarily, they just go around pacing around, commonly it affects the leg and trunk. Parkinsonism, we have seen the entire Parkinsonism is discussed in an entirely different video. Okay. All right. Thank you so much, everyone, for watching. I will catch you up with yet another video on bite-sized medicine, and we will try to post more and more videos for you to help you in the betterment of your learning. Thank you, everyone. Have a good day. Please don't forget to like, share, and subscribe. If you want to part of our bedside medicine group, I'll leave our WhatsApp group. You're more than happy to be a part of us. All right. Thank you. Thank you so much. Have a great day.